On the first segment of the program this morning, we are staying healthy behind the wheels. World Blood Donor Day in view. Yeah, 2 days from now, we'll be marking the World Blood Donor Day. So what does it mean? And how can we ensure that the blood banks in Lagos are still running? They're still as effective as it should be. Well, I have the blood donor champion of Lagos State here with me in the studios. And she's one who's been trying to ensure that lives are saved even at emergency points. Dr. Bodunrin Osikomaya is Executive Secretary of the Lagos State Blood Transfusion Service, and she's right here in the studios. Doctor, nice to have you back in the studios. Good morning.
Yes, good morning. I should have an office in this place.
You should,
yes,
because I know you've been frequenting here for quite a while, and your voice has never been weaned.
Well,
right?
We need blood.
Yes.
We need more blood. It's never enough.
It's never enough, right?
Yep.
So how are we now? Give us an assessment. What's the blood bank looking like in Lagos?
Well, I think in the past 1 year, it hasn't moved up as much as you will think.
Wow.
The voluntary donor rates are still about 13%. It has not changed. However, we're having more donation drives. Okay. So the question is, if you are going out more often, why is the numbers not increasing as much as...
Let us know. What do you think is responsible?
Well, number one of the things, because you do more of external drives, I think one of them is people are beginning to work more from home. So when we go to the companies for corporate drives, some of them are at home. That's my first one. Okay. The second one is probably due to the economic. Everybody's like, oh, there is no money in town,
Oh, probably I've not fed well.
Yes, and they don't even want to check, Even if you cannot know how much blood you have until we'll check if it is adequate or not.
Right.
So because of the economy, people might just feel like, no, don't even bother checking at all, because once I'm fit, you make me donate blood. So those are two of the things. But really, the advocacy is becoming more. As you have said, I've been frequenting this particular station, and as well as other stations talking about it, not just me, but other members of staff and non-governmental organizations too.
Also joining the fray too.
Yes, they've been talking more about it.
Which is very, very good, Dr. Osikomaya. But what is the significance of World Blood Donor Day? Talk to my listeners this morning.
So World Blood Donor Day is basically first to say thank you, and thank you to everybody that has been donating blood, because we are not receiving money for it for the voluntary donors, and so we just want to say thank you. We want to appreciate them. We want to also use that day as a form of like a fun-filled day, celebration day, because I know donors, they will always want to donate blood on World Blood Donor Day. So we tell them, yes, I know you want to donate blood, yes, we know the blood, but we also want you to have a lot of fun. So there will be games, there will be music, there will be a lot of karaoke, there will be a lot of food, eating, whining and dining, and basically too, we will be out on the streets telling people to donate blood.
So you're doing a kind of street blood donor advocacy?
Yes, we're going to have a beautiful donor advocacy starting from 8 a.m. From 7 to 8, we'll be having the distribution of t-shirts and face caps, so that we all go out in the same color. After that, we'll go to the streets, to the markets. We'll be around Bagada's Truck Bariga market today, tomorrow, I mean.
Right. Okay, so for those who do not really understand the concept of all of this, Dr. Bodunrin Osikomaya, how does blood donation contribute to saving lives?
Yeah, because blood, first of all, do they even know what blood is? Let's be sure.
Of course they do. Everybody knows that he has a blood. By the time you hit your feet on something,
that red part of the body is blood. And without blood, you cannot be alive. Blood is what carries oxygen that you breathe in from your nose round to all those essential organs of your body. Blood is what carries the food you've eaten into your stomach down to every part of your body that needs it. Blood is also what helps you to remove all those bad materials in your body and takes it to the kidney where it is excreted, as well as through the skin where you excrete your sweat. So blood does so many things. Within blood, we have all those hormones that make our girls women and make our men and boys men. So without it, you cannot live. Without it, you cannot function effectively. So, and you can only produce blood in the body. It cannot be manufactured. It cannot be grown.
So blood cannot be grown in a lab?
Well, there are many studies being done.
Coming up now.
Yes, I'm really looking forward to such alternatives to blood, as in the real blood. But really, we have not been able to get something that.
So it has to come from us for us to donate it.
Yes, you have to donate it. You just
so what are the benefits of regular blood donation then?
So the first benefit is you get to have a regular health checkup. And really, as I always say, people do not like to go to the hospital. So if you are donating blood, for each time you donate blood, you have a health checkup. The first checkup is to answer some questions where you talk to a healthcare personnel who interacts with you, asks you questions, and then thereafter you have all those blood pressures, pulse rate, your weight, your temperature is done. And the last part before you donate blood, if you are able to pass through those two phases, you'll be counseled and then your blood will be taken for a test. Remember that blood donation is not just giving blood. We are only collecting the extra blood that you have, because we need you to remain alive with your own blood.
Can one have too much of blood in the system?
Yes, you can have too much of blood.
You mean it?
Yes.
What kind of condition is that called?
It's called polycythemia. It's a disease condition. But it's not all the time that too much of blood can be a disease condition. Okay. For people that live in places like Jos, where we call high altitudes, and because they live on mountains, really their blood levels are higher because the oxygen concentration there is different. It's higher than So we have people like that. People that smoke also regularly, sometimes their blood levels are high because when they smoke, it cuts off adequate oxygen into their body, and then the bone marrow assumes there's no oxygen and produces more blood. So there are some conditions that will make the blood to be too much, but it is not good for blood to be too much.
So those that live in hilly places, they are likely to have more blood.
Yes, they have a lot of
let's
blood.
Let's go to Ekiti then. Ekiti and Ondo.
Ekiti, Ondo, Jos, those places. There are places where you will get elder people with a healthy level of high blood.
All right, we're coming for you guys. We need blood from you, Ekiti and Ondo places. All those places where
especially people that go to the short, we should target them in December. They always go to the village, not the village, to their towns.
That's true. Right,
so when they come in January, we should target them.
That's very true. So what are the eligibility criteria for blood donation?
The first thing we always look out for is the age, because before you even talk to us or we do anything, we want to know if you are in that eligible age. That is between the ages of 18 and 65 years old. And the reason why we chose 18 is that it's an age of consent where you can make a decision yourselves. In other climes, if you are less than 18, your parents can take you there. But here, we just want you to be 18 so that there is less confusion, And then for the higher upper range, you must be a regular donor for you to have been able to reach the age of 65.
Right.
The second thing is that you should have been able to answer all those questions we talked about, and you must be in good health, as in you have no issues, the questions are well answered, there are no wrong answers to it. And so if there is an answer that is not supposed to be, then you might not be eligible to donate blood. The third is your weight, at least 50 kilograms. We don't want to take blood from somebody that is underweight, because the less your weight, if we take blood from you, there's a tendency that you can have an adverse donor reaction.
Right.
And then the last thing is we want to check your blood level. It must be at least 12.5 grams per deciliter. That means that the blood you have is enough for you and adequate to give somebody else.
Right. Any misconceptions and myths about blood donation?
Lots of it. I just said another one in recent times.
How was that? Talk to me.
That the blood that is going to be given now is going to be used for elections.
Can you imagine that? What is the connection between blood donation and elections?
Elections, please.
Wow.
The elections is to make sure that there is good governance, and the blood is to ensure that people's lives are saved. Look at what the theme is for this year's World Blood Donors. It says, "Give blood, give hope. Together we save lives." Every drop of blood is hope. You need to see people that need blood. They are hopeless when they do not have that blood.
That's true. Especially when you have an emergencies,
situation. Everything. It is so. One of the concepts of having because the World Blood Donors Day will be celebrated at Bagada General Hospital. That is at the headquarters. One of our concepts of celebrating it at the headquarters and not at public spaces or at parks this year is because we want to open up our facility for donors to see how blood is processed. We also want donors to experience people that need blood coming to collect blood. They need to interact with them and feel the pain these people's relatives feel when they have to come all the way from whatever facilities to collect. But we are a reference center.
Right.
If there is blood where they are, at the hospitals where the patients are, they don't need to come to us. So people that come to us, actually people that were not able to get either the blood group required or adequate number of the blood bags that they need in their facilities. So that is the concept.
Okay, all right. So we're trying to debunk all these myths, and that's what you've been doing for years. Let's touch down a bit bit on, physical attributes. Dr. Osikomaya, when you look at some people, they are well built. When you see this person, you say, blood go plenty for this one body. And then you see somebody else who's very, very slim, or so to say, and you say, no, the likelihood of me having blood is going to be very, very low. So what would you say to those kind of people that say that? Talk to me.
It's just plenty blood, no they show for face.
They shape for face, right?
Must check it. So it's not really about the size, really. It's not about the size. But definitely the weight matters, as I said earlier.
Okay.
You might be big and not have enough blood, and you might be big and have adequate blood. So the best thing is just for us to check, and then we can know where you stand. Now, we have quite a number of our donors that are really slim builds. And I prefer it, honestly, because their veins are very visible. You can close your eyes and put the needle inside.
So these my interns that I have in the studios right now, they can donate blood, right?
Well, somebody does not look like she has a lot of weight in her house. But yes, they can donate blood once they are eligible, and we check if they are adequately, if they have enough blood or not.
So where can people donate?
So you can donate blood at any of the Lagos State Blood Transfusion Service voluntary blood donation centers. We have one at Bagada General Hospital, which is the headquarters. We have one at Lagos Accident Emergency Center, which is at 7-Up. And then we also have one at General Hospital, Lagos. There you will have the Lagos State Blood Transfusion Service voluntary donation centers. Apart from that, you can go to all the state public health facilities, that is the general hospitals and Lagos State University Hospital, that is LASUT. We all have blood banks there. Please go there and donate blood. If you do not want to go to any of the public facilities, we have the big hospitals. Most of them are registered with us. All you have to do is to ask them if they have been licensed by the Lagos State Blood Transfusion Service to collect blood. You also need to look out for the Lagos State Blood Transfusion Service logo. Without that logo, please do not give blood there. That means they've not been trained, they've not been licensed, and they have not been certified to collect blood.
And how often can one donate blood?
You can donate blood at least every 3 months. That means you can donate blood 3 to 4 times a year.
Oh, okay. All right. So now you heard it. For this Democracy Day, I think one major gift that you can give to Lagos right now is to try and see how you can help shore up the banks, the blood banks in Lagos, which Dr. Osikomaya said is depleting. Do I suspect that?
Yeah, the usage is getting higher. So actually, there's something I should say. The total number of blood every year is increasing.
Okay.
Every year it is increasing. But the usage is awesome. And it's good, really. It shows that in Lagos State we are beginning to do more medical things.
I need you to speak to that microphone much more.
Yes. We are able to do better because we are doing cardiac surgeries. There are people with transplants around that needs post-transplant care. We have also, it also shows that we're having more chronic health conditions. More people have cancers that need to be maintained with blood. We're having more people with chronic renal failure. So it shows that the health sector is really becoming more and more active, and they are doing more specialized activities.
Right. So, a message here for you says, good morning, Victor. Happy Democracy Day. Is it true that persons with tattoos cannot donate blood? Susan from Ayobo. Susan, thank you so much for this one. So is it true?
Susan, it is not true. If you have tattoos, you can donate blood. The only condition is you can donate blood after 1 year of the tattoo. So come with your beautiful tattoos. Just tell us when you add that tattoo, and we can even, if you are donating blood, Susan, or any of your friends that have tattoos, please, if it is after 1 year of when the tattoo was created, take a picture and send it to us to tell others with tattoos that tattoos does not stop you from saving lives.
All right, so Susan, you can get your friends, all of you who have been tattooed in one way or the other, please, you can still donate blood. That's what the executive secretary is saying. Another one here says, hello, Traffic Radio. Is it true that donating blood can actually benefit your own health, or is it just something they say to encourage people to donate? You didn't put your name, but thank you so much. So is that true? Is that the trick you guys use?
Yes. No. It's not the trick. Look, I like the fact that we have a lot of people that have access to the internet. So first, apart from the fact that you have a health check done, you also have an opportunity for your relatives to receive blood without replacement. So donate blood. It's not
true.
Just it's true. Last is that there are lots of studies. Number one, people that donate blood regularly are happier. People that donate blood regularly have a lesser incidence of having cardiac conditions and stroke. People that donate blood regularly have a lesser incidence of some types of cancers.
Wow. All right. The message here says, Dr. Osikomaya, is there a way to track where your donated blood ends up? Francis is sending this one in. Francis, thank you so much. So is there a way one can do that?
Yes, there is a way. And I'm happy to tell you, Francis, that what I'm going to tell you has been certified by some of the international bodies that have come to review us. What we are talking about is called traceability. Because we do a lot of documentation. Once you tell us where the blood is donated, it goes to the blood bank. The blood bank will issue it out to somebody. It is documented in what we call a blood movement chart. And beautifully so too, this month we would tell everybody about our blood inventory management system, which is a fully automated system. So right now we're already using the blood inventory management system. I'm sure you would have started seeing some blood with QR codes where you can use your phone to know where the blood is coming from. And before they use it it is also documented in the system who is receiving the blood. So traceability is a key part of safe blood, and that is what we do in Lagos.
A lot of innovations, I can tell you, in this blood donation drive. This one here says, good morning, Lagos Traffic Radio. My question is it okay to donate blood if you smoke or drink occasionally? B from Ogba. B, thank you so much for this one as well.
Yes, it is okay if you drink or smoke occasionally. What we'll advise is that please 24 hours before, try to refrain from it. And after you donate blood, also do not smoke or drink at least 24 hours after. So the reason is that once you do that, it makes you dehydrated. So people that smoke or drink before or after have a tendency to faint. We call it it's called a vasovagal reaction. There's a higher tendency that you will faint because it makes you more dehydrated. So you want to save lives, you don't want to rush you to the hospital. All
right, then. So the impediment at Anthony in Watsoshodi, I understand from the control room, is receiving attention right now. So any moment from now, that should be taken off. Thank you so much, Moyolicious, for sending that one in. Let's begin to round this all up. Dr. Osikomaya, so on Saturday, where is the celebration kicking off, and what's the whole idea for that day?
So all road leads to the Lagos State Blood Transfusion Service headquarters located within Bagada General Hospital by 8 a.m. Please come in to pick up your t-shirts and your outfits for the road walk. The road walk starts by 8 a.m. and after the road walk, we'll just have fun, a lot of games, a lot of eating, a lot of networking with others, and a lot of insight into the operational center of the Lagos State Blood Transfusion Service. All
right, we'll leave it at that for now. It's nice having you around. Thank you so much for being here.
Thank you. I'm expecting you.
Yes, I'm coming, and I'm coming to donate as well.
Thank you very much. Yes.
All right. She is Dr. Bodunrin Osikomaya, and she is the Executive Secretary of the Lagos State Blood Transfusion Service. We've told you we're trailing World Blood Donor Day. It's on Saturday. Please make yourselves available, and let's see how we can save more lives in Lagos. All right. We're going to take a brief break right now. When we return, we'll do our birthdays before we switch to Build Right.